Hello everyone and welcome to my channel Body Mind Healing. My name is Maria Sanchez. I am a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor in nursing practice. The case for today is difference between PTSD and CPTSD. As mentioned in a previous video about post-traumatic stress disorder or PTSD, this is a mental health condition that develops after experiencing or witnessing a traumatic event such as combat, natural disasters, accidents, abuse, or assault. PTSD can develop at any age and significantly impact daily functioning. Symptoms generally fall into four categories. First, intrusive symptoms such as flashbacks, nightmares, and unwanted distressing memories. Second, avoidance, avoiding reminders of the trauma, including people, places, or thoughts. Third, negative changes in thinking and mood, including emotional numbness, guilt, shame, or difficulty experiencing positive emotions. And fourth, hyperarousal, heightened startle response, irritability, insomnia, or difficulty concentrating. Now, complex post-traumatic stress disorder or CPTSD is similar to PTSD but results from prolonged, repeated trauma, often in interpersonal relationships. CPTSD is commonly associated with trauma occurring in early developmental years, affecting core beliefs and identity. Examples include childhood abuse, long-term domestic violence, or being a prisoner of war. In addition to PTSD symptoms, CPTSD includes first, emotional dysregulation such as difficulty managing emotions, frequent mood swings, intense anger, or deep sadness. Second, negative self-perception such as deep feelings of guilt, shame, or worthlessness. Third, interpersonal difficulties such as struggles with trust, maintaining relationships, or fear of abandonment. Fourth, dissociation such as feeling detached from reality, oneself, or emotions. So again, key difference between PTSD and CPTSD. In a nutshell, PTSD typically results from a single traumatic event, while CPTSD arises from prolonged or repeated trauma. Let us look into this differentiation more closely. Trauma type in PTSD is a single event trauma. In CPTSD is repeated prolonged trauma. The symptoms in PTSD are flashbacks, avoidance, hyperarousal. In CPTSD, the symptoms are PTSD symptoms plus emotional dysregulation, identity issues, interpersonal difficulties, and dissociation. The self-perception in PTSD may not significantly impact self-worth, but in CPTSD there are deep feelings of shame, guilt, and worthlessness. The interpersonal issues in PTSD are avoidance of trauma-related reminders. In CPTSD, there is difficulty trusting maintaining relationships. Dissociation in PTSD is less common, but in CPTSD, it's more common and may include emotional numbness. As a side note, CPTSD is not officially recognized in the DSM-5, but it is acknowledged in the ICD-11 or the International Classification of Diseases as a separate condition from PTSD. The treatment approaches for PTSD and CPTSD require tailored treatment approaches, often involving a combination of therapy, medication, and self-care strategies. But because CPTSD involves more complex emotional and interpersonal issues, treatment typically requires a longer and more integrative approach. One of the most effective treatments for both of these mental health problems is first, psychotherapy or talk therapy, and this is the cornerstone for PTSD and CPTSD. The most effective therapies for PTSD, cognitive behavioral therapy that helps patients identify and change negative thought patterns related to the trauma, prolonged exposure therapy that offers a structured approach to gradually help patients confront trauma-related memories, feelings, and situations in a controlled way. And eye movement desensitization and reprocessing, or EMDR, that uses guided eye movement to help process traumatic memories and reduce their emotional intensity. For CPTSD, we can use these three previous ones in addition to trauma-focused cognitive behavioral therapy, which is a modified CBT form that includes strategies for coping with complex trauma, Also, dialectical behavioral therapy, originally developed for borderline personality disorder, and it is very effective for CPTSD, especially for emotional regulation and interpersonal issues. The Schema Therapy helps patients recognize and restructure deep-seated negative beliefs about themselves formed due to prolonged trauma. And the Internal Family Systems Therapy, which addresses inner parts of the self that might hold trauma-related fears or responses. Regarding medication, while therapy is the most effective long-term treatment, medication can help manage symptoms like anxiety, depression, and hyperarousal. Medication can be specifically beneficial for PTSD, but is often less effective alone for CPTSD, which requires a more holistic approach. Among the most common medications, we have the selective serotonin reuptake inhibitors, or SSRIs, such as sertraline and fluoxetine. These are first-line medications for PTSD. Serotonin norepinephrine reuptake inhibitors, or SNRIs, such as venlafaxine, that can help both anxiety and depression. Prazosin is used for PTSD-related nightmares and sleep disturbances. Mood stabilizers and atypical antipsychotics are sometimes used for CPTSD when emotional dysregulation is severe, and among those we have the lamotrigine and quetiapine. Regarding self-care and lifestyle approaches, building healthy coping strategies is essential for managing PTSD and CPTSD. Some helpful approaches include mindfulness and meditation that helps regulate hyperarousal and dissociation, exercise that helps improve mood and reduce stress, healthy sleep habits that help combat nightmares and insomnia, creative outlets such as writing, music, or art therapy that can help emotional expression, and support networks. Support groups, therapy groups, and close friends and family can provide emotional validation and connection. Regarding somatic and alternative treatments, particularly for CPTSD, since PTSD is often deeply ingrained in both the mind and body, body-based approaches can be particularly helpful, including somatic experiences that focuses on releasing stored trauma in the body, yoga and trauma-sensitive yoga that can help restore a sense of control over the body, acupuncture and massage therapy that help reduce physical symptoms of stress, and the equine therapy and nature therapy because engaging with animals or nature can be soothing for emotional regulation. Let's review again some key differences in treatment of PTSD and CPTSD. The main focus in PTSD is reducing trauma symptoms and intrusive memories. And in CPTSD, the main focus is addressing self-perception, emotional regulation, and relational difficulties. The therapies used for PTSD are usually CBT, exposure therapy, EMDR. For CPTSD, we can use the same ones in addition to DBT, schema therapy, and somatic therapy. Medications for PTSD are SSRIs, prazosin for nightmares, and several others. For CPTSD, the same ones in addition to mood stabilizers for emotional regulation. However, in PTSD, sometimes we have to also use mood stabilizers because the symptoms can be pretty severe. And for healing timeline in PTSD may improve significantly within months, and for CPTSD requires long-term layered treatment. In summary, PTSD treatment is often symptom-focused, aiming to reduce intrusive memories, flashbacks, and avoidance. CPTSD treatment is more holistic, focusing on emotional regulation, self-perception, and relationships in addition to PTSD symptoms. A combination of therapy, medication if needed, and self-care strategies can help patients regain a sense of safety and well-being. May the inner peace that we cultivate today expand and guide us always. Until next time.